Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what are the available knee injections for arthritis? Over 40 million Americans suffer from arthritis. It's the leading cause of disability in the U.S. More women than men suffer from arthritis by about 20%. The total cost for arthritis treatment in the U.S. exceeds $100 billion a year. Between 2000 and 2010, the number of knee replacements in the U.S. doubled. I can tell you right now the population of the U.S. didn't double, just the amount of knee replacements. There's about 600,000 now performed each year. By 2030, with all the baby boomers and increasing population getting older, that demand could reach 3.5 million annually. 35% of those who receive a knee replacement are younger at 50 to 69. So a knee replacement is elective. It should only be performed after considerable conservative treatment, which may include over-the-counter or prescription pain medications, topicals, physical therapy, bracing, and injections. There are various types we'll discuss here. Cortisone, which has been the gold standard for decades, hyaluronic acid, such as Synvisc, and then regenerative medicine injections such as PRP, bone marrow aspirate, fat-derived stem cells, or amniotic-derived stem cells. Cortisone injections since the 1950s have been performed. They've been a mainstay of arthritis treatment. Initially, they were only done for rheumatoid arthritis, and then a few decades later, it spanned over into osteoarthritis. They don't cure anything. They're basically just a pain-relieving mechanism. It is questionable if they harm cartilage. That has not been shown to date in a large study. It was shown in a small study of small animals. It was not shown in a large animal study, and it hasn't been shown in humans. Studies show that three-fourths of people receive good to excellent results that may last months at a time. They are the gold standard for knee arthritis treatment. Hyaluronic acid injections have been FDA approved since 1997. Hyaluronic acid is the motor oil that's normally found in the synovial fluid of our joints. There's numerous trade names: Hyalgan, Synvisc, Orthovisc. They're all made from rooster combs, which is a great source of a biologically equivalent hyaluronic acid. None of these products has shown superiority to another. One of the largest U.S. studies showed the beneficial effects in 80% of patients for over 6 months. The theory is that it helps provide lubrication, anti-inflammation, and the theory is that it compels your joints to make more cartilage. PRP therapy is platelet-rich plasma therapy. It involves a simple blood draw that can be done in the office, and then the blood is spun in a centrifuge for about 15 minutes that concentrates the platelets and the growth factors. It may involve 1 or up to 3 injections over a period of 6 to 8 weeks into the knee. There have been several studies showing significant pain relief. 70% good to excellent results at 6 months in one study, and that same study showed preservation of cartilage in over 70% of patients at 1 year. In that study, patients were only given 1 injection of PRP. Stem cell injections have potential to alter the course of arthritis and not just to mask pain. PRP therapy does not directly contain stem cells. It's platelets and about 7 different growth factors. It does call on your body's own stem cells, but with stem cell therapy, you have all that in there already. They're either from bone marrow derived, fat derived, both those come from your own, or then amniotic derived, which comes from a donor. It goes to an FDA regulated lab. None of these involve embryonic stem cells or fetal tissue. Now, there have been various studies. One for knee cartilage defects showed that 6 months after the stem cell transplantation, the patient's clinical symptoms had improved, and that had been maintained for about 2 years. There have not been large clinical studies in humans to prove efficacy, but there have been lots of small studies showing the effectiveness. There are various types of knee injections available. All are low risk and outpatient. In combination with other treatments, they may help delay or avoid the need for knee replacement. All can be repeated every 3 to 6 months as needed. The PRP and regenerative medicine treatments are out-of-pocket costs right now. Hyaluronic acid treatments are covered by insurance, along with steroid injections. The top non-operative pain management in Texas is through the Texas Pain Network. There are several pain clinics throughout the state participating, accepting over 50 insurances for the board-certified physicians. Visit us online today for treatment in the Austin area at painmanagementaustintx.com, and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.